CICU devices.
Cardiosave intra-aortic balloon pump, blood back events, safety alert. Intra-aortic balloon pump therapy remains one of the most widely used and accessible forms of mechanical circulatory support in contemporary cardiovascular care. Its primary function is to reduce left ventricular workload and enhance coronary perfusion through the principle of counterpulsation. The system consists of a polyethylene balloon positioned in the descending thoracic aorta and connected to an electromechanical console that delivers timed inflation with helium. Specifically, the Cardiosave hybrid console is one of the most frequently used systems of counterpulsation in routine clinical practice. In November 2022, Getinge initiated a voluntary medical device correction following reports of unexpected shutdowns of Cardiosave intra-aortic balloon pump consoles associated with blood entering the device after intra-aortic balloon catheter perforation. More recently, an updated communication issued by the company in July 2025 confirms that these events have continued to occur and provides a summary of the findings from the internal investigation. The root cause was determined to be blood entering the console through the extender tubing when therapy continued with a perforated balloon that was not detected promptly by the user or the system. Balloon membrane perforation may result from mechanical contact with calcified aortic plaques, sharp instruments, or material fatigue. This event may lead to the following clinical consequences: a leakage of helium from the catheter into the patient's bloodstream, which may result in gas embolism, posing a serious clinical risk. In other cases, blood may enter the catheter. Under such circumstances, thrombus formation within the device is possible, potentially leading to arterial thromboembolic events. When blood enters the catheter, it may reach the helium tubing and, in certain situations, extend into the IABP console. In such cases, device function is compromised, resulting in a significant reduction or even complete interruption of circulatory support. If blood reaches the driving unit, there is an additional risk of internal contamination, which may pose a cross-contamination hazard between patients and increase the likelihood of mechanical dysfunction of the driving unit itself. In response to this event, the company has implemented a series of corrective measures. Getinge has introduced a hardware design change to the pneumatic interface module by adding a containment filter to prevent blood or fluid from reaching the printed circuit boards and electronic components. In addition, the company has deployed the following: an enhanced sensitivity for detecting pressure changes suggestive of balloon perforation, a new high priority alarm that reads, "Blood suspected, check catheter and tubing," a new technical alarm that reads, "Pump failure, service required," and another new technical alarm that reads, "Power up test fail code number 15 for consoles previously exposed to blood." These updates are intended to allow earlier identification of perforation and prevent resumption of therapy until the pump is serviced. The company also reminds users to follow the previously outlined recommendations in the event of suspected balloon perforation, which include the following. If balloon perforation is suspected, clinicians must immediately place the IABP in standby mode by pressing the standby button on the console. Disconnect the helium extender tubing from the driving unit and clamp the helium tubing between the Y fitting and the male connector. Prepare for possible removal of the IAB catheter and assess the patient's need for ongoing circulatory support, considering insertion of a new IABP or escalation to an alternative mechanical circulatory support device, such as Impella or ECMO, if clinically warranted. Finally, if blood is suspected to have entered the driving unit, the console must be taken out of service until evaluated by the technical service department to determine whether replacement of any potentially contaminated components is required. The company further recommends that a spare driving unit be readily available whenever a patient is receiving IABP support to allow immediate replacement in the event that blood enters the console. Finally, Getinge is updating the instructions for use to include these new clinical considerations.
Press the like button and subscribe to stay updated on the latest CICU device safety alerts.